Thank you so much, Charlie. And we're becoming a good tag team group as we barnstorm the country on behalf of healthcare reform. And I'm hugely grateful for your friendship and for all the leadership you provide for CED in trying to get the business community engaged in a different way on these issues. So I salute you as always, and CED in general. And it's a delight to be in the company of Mayor Hickenlooper, who I admire, and also Dick and Dottie Lamb, who I want to at least single out because they've been great friends and mentors and inspirations to me at various times over the last 20 years, and I'm grateful for their friendship, and sorry our visit is too brief today, but it's a pleasure to be with you. And I'm delighted to be in Denver. I have spent with my family a lot of time on your ski slopes and hiking trails over the years, and I'm always glad to have a reason to be in Denver for a little while because you have a beautiful, gorgeous state that's a leader, I think, in trying to combine environmental progress with economic development in ways that all these things can coexist with a sane quality of life. And so it's doubly fun to be here for all those reasons. And I do have to confess, I'm from California, and I have been assured that our total fiscal chaos and civic chaos and ungovernability cannot be transmitted in person. So please do not be afraid. I'm told that it actually takes years of exposure to our dysfunction before it can really seep into the bones. So you're in no harm being in proximity to me during this lunch. We obviously meet at an auspicious moment. There's just an enormous number of things on the nation's plate and on the new administration's plate. The economic situation, obviously the most dramatic situation in generations, arguably. GM and Chrysler going through entire bankruptcies and reorganization. North Korea firing off nukes, as we saw just last week. So the plate is full, and yet if you saw the news yesterday and overnight, President Obama said that this year it is now or never for health care, that if we don't get systemic reform done, really in the next 90 to 120 days, I would say, that window may have passed. And so the fact that President Obama is pushing this so aggressively at a time when so much else is on the nation's plate, and I think he's right to, signals the importance of this and the importance of us taking a few minutes out of our day to contemplate what role business can play, what role you and your role as civic leaders can play, as Mayor Hickenlooper urged, in trying to really move this debate forward and put the heat on Washington to get something done that's constructive and really indispensable for the nation. I was a veteran of the last attempt. I worked at the White House Office of Management and Budget in '93, '94. I'm not to blame for our failure to do health care then, but I was certainly a close eyewitness to what went wrong. And in my view, the Obama team and Congress have taken all the right lessons from what became a fiasco in '93, '94, and have a real chance to make progress on this in the period ahead. Now, one of the things I think we should think about, and my main message that I'd like to convey in the CED context today, is that as we look at what may be this potential for really dramatic change in the next 90 to 120 days, I don't think business is thinking clearly about what its role should be in the healthcare system, and therefore what its role and objectives should be in the debate that, for all the prelude we've had in the months and really years prior to this moment, is really going to crescendo and play out in the period ahead. And let me illustrate this with a story. Not long ago, the head of one of the biggest unions at one of the biggest brand name employers, I'm going to leave them nameless for now, went in to, and this is a union that represents hundreds of thousands of employees at one of America's most famous companies, went in to the management and said, we want you to look at something. What would the impact be on your profits and on shareholder value if a national health reform was passed, not the dread single payer, so let's take that off the table as a canard, but if national health reforms were passed that made sure that every American had some kind of basic health coverage and also permanently lowered the contribution your corporation makes to the cost of that coverage, what would the impact be? Well, the executives went off and said, we'll take this and look at it. Sometime later, they came back, and one of the senior executives from the firm called up the union leader and said, you know, we looked at what you suggested, and you're right. The impact is huge. It's unbelievable. And the union leader said, great, we'd love to sit down and discuss it with you. And the executive said, you know, I'm sorry, we're actually not comfortable discussing it. And the union leader scratched his head and said, what do you mean? Why? And the executive paused, and then he said to the union leader, because the numbers are so big, this is the impact on shareholder value and profits, the numbers are so big that you'll never understand why we don't want to pursue this as a matter of policy. Now think about that sentence for a second. The numbers are so big that you'll never understand why we don't want to pursue this as a matter of policy. Now, the mindset that can produce that way of thinking is, I think, and that's the business mindset today on healthcare, is one of our biggest potential obstacles to the trajectory of reform that we need. And when you think about it, we're about to have, if my own sense of this is right and some others who feel the same way, there's a very good chance the stars are aligned for some major reform over the next few months, something that people have been talking about doing for decades. And yet at the end of that, on our current course, business will emerge from the reform that's now being contemplated, remaining at the center of America's welfare state and still responsible for the provision of most Americans' health coverage and for the enormous burden of skyrocketing costs that comes with that. And business will emerge from this reform period at the center of America's welfare state, where it is uniquely compared to the rest of the industrial world, because that's what business says it wants. That, I submit to you, is a strange anomaly and suggests that business's thinking on this is sort of tied up in circles. Now, this is what I call, in my new book, a dead idea. Business is in the grip, and many of us are in the grip of this dead idea that your company should take care of you. Your company should be the place you go, not your country, to assure the provision of sort of basic security on major life issues like health care. And I think that the way that we got to having this system being at the center of U.S. policy is misunderstood. The usual story that the policy wonks tell is that back in World War II, when there was a freeze on wages and prices, benefits were exempt from that. And so companies competed for talent by offering these new health care benefits. And then after the war, the federal government came in and ratified that arrangement with a big tax subsidy, and the system grew enormously to the point where it is today. Now, that's true insofar as it goes, but it makes it sound as though our massive, though poorly understood, corporately administered welfare state was really the accidental byproduct of wartime pricing policy. And I think the more interesting story dates back to the early 1900s, when we were in the first period of a rebellion against the excesses of industrial capitalism. Coal miners were dying in the mines, sweatshops were prevalent, unions were getting traction. In Europe, labor parties were forming that were pushing an agenda that was ultimately became socialism in many areas. And the U.S. business community and its conservative political allies here got together and said, wait a minute, we want to put a lid on this. We have to find a way to put a lid on the growth of unions and the growth of the state. And the strategy that was arrived at back then in the early 1900s, not through some, 6 guys sitting around a table, but the de facto strategy that was arrived at was for the major vertically integrated companies, because a lot of our major industries were almost quasi-monopolistic at the time, to start offering various forms of benefits, to share the wealth, to share some of the bounty of growth, so that it afforded a better sense of security to workers at that time.